You are welcome to my channel. Thanks for visiting. Please kindly remember to subscribe. Today is all about chloramphenicol. This is an antibiotic. Are you familiar with it? Not quite. Don't worry. All the files are here. Let's go. Let me quickly take you through the first note that will serve as the window to the entire presentation. The bone marrow. The bone marrow will be suppressed if you are taking this medication, particularly if you are taking it for a long time. In children, particularly neonates, the newborns, the infants, premature babies, newly delivered, taking chloramphenicol, there may be gray syndrome. The gray syndrome, now good to know that is very rare, but when it occurs, it could be serious. As a matter of fact, it could be fatal. And this will occur when the serum level of chloramphenicol is greater than 50 micrograms per ml. And the features here will be cyanosis, abdominal distension, vasomotor collapse, irregular respiration, and death. So watch out for that. So why is it that we cannot use chloramphenicol in all conditions? It is restricted to serious or severe or life-threatening infectious conditions where other agents that could be used are not available, but only chloramphenicol is available. Is it helpful in malaria? Yeah, to some point. The multiplication of malaria parasites can be halted when you are using chloramphenicol, particularly over several essential life cycles. But that is not to say you would then be prescribing chloramphenicol to treat malaria because of the horrible side effects. Anyone on chloramphenicol and any physician prescribing chloramphenicol will definitely become a friend to those people in hematology. We have to watch the blood level and the bone marrow. We'll go into details later on. We must follow the liver. We must remember our kidney. The brief history when it comes to chloramphenicol is such that it is isolated from Streptomyces venezuelae, that is from Venezuela, right? Latin America, in 1947. But it was synthesized in 1949. It is a broad spectrum antibiotics. Now, this medication could come under different brand names. Remember, my presentation is for the entire globe. So if a brand is not available in your country, that is not to say that brand name is not, chloramphenicol. No, don't take it that way. So it could be chloramphenicol permitted and camicetin 250 milligram or 500 milligram capsule, but I've decided to bring this out that there is difference between camicetin 250 or 500 capsule and camicetin antiozena. Antiozena is not antibiotics, it is estradiol. Why camicetin 250 or 500 milligram capsule is the antibiotics. Okay, chlorampaz, chloramycetin, succinate, agromycetin, ariphenicol, recol, chloramphen, centromycin, not centroid, zepanicol, levomycetin, fencol, and the list goes on. Remember, different pharmaceutical companies, different countries, different brand names. As per the class of agent that chloramphenicol belongs to, it is a miscellaneous, broad-spectrum, bacteriostatic, not bactericidal, antibiotic. Let me repeat, it is not the first agent that I will grab when I have bacterial infection. Why? I'm afraid. Bone marrow suppression. And you know what that entails, right? Pancytopenia, immune suppression, and so on. Because of aplastic anemia, right? and it may end up as leukemia. So it's not the first line antibiotics. Okay, if the case with chloramphenicol is what I've just said in the last 1 minute, then why do we use this medication at all? Well, it is a very good medication in the face of severe bacterial infection or life-threatening bacterial infections where other agents are not effective or not available. It has a good cerebrospinal fluid and blood-brain barrier penetration, and it's going to bind to protein. Now, specific uses. In cystic fibrosis, chloramphenicol could be helpful when it comes to acute exacerbation. The reason why that must be clearly defined is that we cannot place anyone on chloramphenicol indefinitely. No. So in cystic fibrosis with acute exacerbation, when other agent is either not available or not helpful, you can use chloramphenicol. In meningitis, and to be precise, bacterial meningitis caused by chlamydia, Haemophilus influenzae, Rickettsia, or Salmonella species. Those who have listened to my presentation on typhoid fever would have grasped the info that I made a reference to chloramphenicol when it comes to Salmonella. Then, in Rickettsia, particularly Rocky Mountain spotted fever, chloramphenicol will be helpful. As a matter of fact, when we see a pregnant woman, not in third trimester, in second trimester to be more convenient, with Rocky Mountain spotted fever, we may use chloramphenicol, keeping an eye on the woman very closely, but not in third trimester. Forms will come in form of suspension for per oral use, particularly in pediatric age group, and you can administer that as 6.25 to 12.5 milligram per kilogram every 6 hours. Then, could be in form of capsules, also for per oral use. In that case, it could come under the brand name that is available in your country as 250 milligram generic or the brand in your zone per capsule. Some will be 500 milligram per capsule. Okay, and it could be in form of solution for intravenous use. In that case, it must be reconstituted. You are going to find out under generic like 1 gram or chloromycetin cisinate 1 gram or the brand that is available in your country. And lastly, on forms. It could be the chloramphenicol ophthalmic brand that you could grab from your pharmacist without prescription, meaning over the counter. In that case, could be chloramphenicol eye drop, 0.5%, or chloramphenicol eye ointment, 1%. Now, dosing or administration. You may go for 10 to 20 milligram per kilogram intravenously every 6 hours, but the maximum you can give is 4 grams per day. These intravenous routes may take different forms. You may decide to give it intravenously push for at least 1 minute at the rate of 100 milligram per ml after you must have calculated the total daily dose, then you divide. Or you may go for intermittent IV infusion over 30 to 60 minutes, particularly in pediatric age group. Then another form that some will use in some parts of the world is you put the normal saline or D5 up depending on what the patient, what is suitable for the patient. Like somebody having cerebral edema, you will not go for D5 again, right? And you will not go for much volume. So you put that up, then you add your chloramphenicol to the IV fluid as it may be appropriate. Then the dosage here mostly will vary from 6.25 to 25 milligram per kilogram every 6 hours. That is from the pediatric age group to adult age group. And the maximum you can give in a day is 4 grams per day. Now, contraindications to the use of chloramphenicol. Number one, hypersensitivity to chloramphenicol means we are not going to use it in this patient if that history is already there. Then, in hepatic or renal failure that is profound, no chloramphenicol. In anemic patients, no. Why that? Remember, aplastic anemia. Okay? Then in any individual with bone marrow depression already, we will not give chloramphenicol today. In a woman that is breastfeeding, no chloramphenicol. Monitoring. Like I've now alluded to earlier, that if you don't like the brilliant people in hematology department, then you may as well run away from the use of chloramphenicol. With that, you will need their services. So we'll monitor the efficacy and the side effects of this medication by first of all having peripheral blood film before the administration of chloramphenicol. Then we'll have complete blood count differentials every 2 days while on the therapy. We must have liver function tests done, including renal function tests as well. And it will be fine if we have the technology to have serum chloramphenicol level assay. Remember, the gray syndrome, when the serum level is greater than 50 microgram per mil, then the premature neonate can be treated to gray syndrome. Now, adverse reactions. Some will say, oh, doc, you've been emphasizing the complications, the adverse reactions of these medications than the benefit. Well, we need to face the fact it's a good medication, very helpful, but we can run into diarrhea, glossitis, nausea and vomiting, aplastic anemia, bone marrow suppression, and I will not shy away from repeating in that it will lead to immunosuppression and pancytopenia. Hypersensitivity may occur, like I've said. Also, optic neuritis when you use the ophthalmic type of it. Gray syndrome, like I've said earlier, in newborns, particularly the premature babies. There may be confusion or delirium. Some can become depressed, and some will have headache. We have seen cases of urticaria and some with enterocolitis. So it depends, because sometimes there may be idiosyncrasy when people will react differently as per comparison with the general populace now. So some people will react in a way or in a pattern that is not really common to everyone. Now, first thing here is go over the first note and go over the adverse reaction and contraindications. Then you should be fine. Remember the pancytopenia, remember the bone marrow suppression, and then we will not use this medication for a long time. 5 to 7 days is enough. Okay? Remember the gray syndrome with cyanosis, abdominal distension, vasomotor collapse, irregular respiration, and death. Though rare condition, but 1 death too many. Remember, there's likelihood of bacteria or fungal superinfection after a prolonged use. So we will also remember that we may run to pseudomembranous colitis, C. difficile, C. diff, Clostridium difficile or Clostridioides difficile, when we use this medication for a long time. As a matter of fact, it doesn't have to be for a long time in some individuals when it is used by oral. Reduce the dosage then, reduce the duration that the individual will be on this medication. And at the same time, let there be adequate liver, keep an eye on the liver, keep an eye on the kidney. So, renal function test, liver function test, liver enzymes. Finally, on warnings, be careful with individuals who must have been diagnosed with G6PD deficiency. Be careful. Drug-drug interaction. Those who are familiar with my channel will know that I will always leave this for my other colleagues, the pharmacists and clinical pharmacologists. Why that? The list is pretty long, and I may not be able to say the one you may be taking at the time that chloramphenicol will be prescribed to you. So, the medication you are taking right now, discuss that with your physician, discuss that with your pharmacist. They'll be able to figure out whether or not there'll be drug interactions, because no doctor will prescribe two medications that will have profound effect on the bone marrow. Now, pregnancy and chloramphenicol. This medication can cross the placenta. That is dangerous, eh? Remember, we've just talked about Graves syndrome, particularly in premature infants and neonates generally. So, someone will ask me, then, doc, why do you need to use this in a pregnant woman? Well, I would not prescribe this in a pregnant woman, but if a pregnant woman comes down with Rocky Mountain spotted fever, you can take the risk. However, don't take the risk in third trimester. So, in pregnancy, you can use this if you are faced with Rocky Mountain spotted fever in a pregnant woman in second trimester. That is very convenient, but not for a long time, right? No, for a short period. Okay, breastfeeding. I will not prescribe this to any breastfeeding mother. So the best thing generally is to avoid this medication in a breastfeeding mother. Particularly if the mother is fortunate to have the baby alive, but the baby is premature, then we are not helping. Remember the Graves syndrome. Or the baby is with low birth weight, and still a neonate. No, I will not prescribe it at this time. Diet. Somebody is happy to see someone sitting down with a table and food and need to eat. I'm not going that way. Remember the horrible effect of this medication on the bone marrow and hematopoietic stem cells. So we need to do something to help ameliorate that horrible side effect, in anyone taking this medication. So increase riboflavin, increase pyridoxine, check the level of vitamin B12 and give, if there's need to. With that, I've come to the end of this presentation. Chloramphenicol is a good medication when we are faced with life-threatening bacterial conditions where other agents will either not available or not working well. We will give it for a short time, and we'll keep an eye on the blood and the bone marrow. Thanks for listening. Remember to share this. Remember to subscribe to my channel. Once again, I appreciate it.